My topic is Does China Still Need Support? I'm from Guangdong Cardiovascular Institute, Guangdong General Hospital. Guangdong is at the southern part of China. You see, left side is the Berlin, and this here's the Guangdong province. Our institute was established in 1958. It was a WHO corroborating center for cardiovascular disease since 1980. Department of my cardiac surgery in 2013 was 4,500 cases. I was specialized in pediatric cardiac surgery. We finished about more than 1,900 cases. Among them, VSD, ASD, PS, PDA repair accounts for about 56%. The other complex procedures include tetralogy fellow 160 and TAP-AVC repair 60, AV canal repair 50, and the single ventricle that includes the TCPC 43, Glenn procedure 41, and also arterial switch operation 44, PAVSD, and also PIVS procedure 44, IA repair 11, node stage 1, 4. There were 35 deaths. The mortality is 1.8%. To compare our results with other European centers and also to improve the quality of treatment of children with CHD, we registered in EACTS congenital database in February 2009. This is the congenital database in Chinese version. Yeah, this is the number of our institute, number of patients we sent to the database. The last year's data is not completed. Each year we send about 2,000 cases. This is the basic score compared with the database. Performance is 6.51, and the basic score is 6.64, and the mortality is 1.9. We have input a total of about more than 8,000 patients. This is the basic score split by continent. We can see that the Asia has 19,000 patients, and we account almost half of the total Asian patients. This is the basic score split by year. We can see our performance, and basic score is increased steadily year by year, and also the mortality in 30 days is decreasingly significantly. This is the basic score split by age group. We can see that the neonates in our group is a little higher than the database mortality. It's 11.68%. And also the performance and the basic score is lower than the database. This is the data split by year and the age group from 2009 and to 2011, our neonate performance basic score is gradually increased, and the mortality is very high in 2011. This is the split by year and the survival. That the alive patients' basic score is gradually increasing, and also the dead group. From the database, we can also evaluate the surgeon's performance. We can see the surgeon's performance and his patient's the basic score and the patient mortality. And also we can evaluate the surgeon's performance by each year's performance. The database also provide the bubble chart for easy to see what we done. This is the bubble chart for the number of operations for the workload. You can see we are at the far end of the chart. This is the 2013 workload. This is the basic score of our institute. This is the 2012's data, and this is the 2013's data. And we can see the basic score is a little bit lower, below the average, but the hospital survival is higher than the database average. This is the neonate of our institute, and the basic score, and also the hospital survival rate is below the average. This is the 2012, and this is the 2013, and we can see that we are gradually improve our performance. This is the infant data. This is the child from 1 to 18 years old. The basic score and the hospital survival is both are above the database average. This is the adult group. Basic score is a little lower below the average, and the hospital survival is higher than the database average. This is the mortality score, and also the mortality score is a little bit lower than the average, but the hospital survival is higher. This is the mortality score in 12, mortality score in 2013. This is the IPPV time. Here we can see that most of our patients have longer ventilation hours. This is the length of stay in our hospital. Also, the patients stay longer in our hospital. This is the number of procedures compared with the database. We can see that our total procedures, number of procedures, is almost about 10% of the total ESCTC database amount. This is the hospital mortality of our hospital compared with the ESCTS database. It's a little lower. And this is the hospital mortality compared with the European centers. It's also a little lower. This is the basic score. This is the performance compared with the EACTS database, and a little below the EACTS database. This is the performance compared with the European centers. Here I introduce our experience to the EACTS congenital database. From this chart, we can see our performance gradually increase, and the basic score gradually increase, and also our mortality score increases. Our patients' number increases each year, and our 30 days mortality gradually decreasing. But there are also problems, that is how to ensure the data completeness and the data accuracy. So besides we try to complete and accuracy, and we are going to invite the database coordinator to visit our institute and to check the reliability of our data. And I will spend several minutes to tell about the congenital heart surgery in China. We have large populations and a large population of congenital heart surgery patients. In 2012, there were 84,000 patients, account for about 40% of total cardiac surgery. The growth rate is about 5%. But this growth is unbalanced. From this chart in Chinese, but I can tell. There were only one hospital has the on-pump surgery more than 5,000, and at the end of the chart, that open heart surgery less than 50 cases each year is 340 hospitals, and less than 50 to 200 cases each year on pump cardiac surgery is 240 hospitals. Also, there were no prenatal screening of congenital heart disease is not a routine test. In rural areas, there were no fetal echocardiography, and even the child was born, there were many times it's failure to diagnosis. And also, in our routine work, we can see many delayed diagnoses for treatment, like PTA-PVC coarctation. When the children was sent to our hospital, it was usually in very critical condition. And also, TGA IVS patients, sometimes it was 3 months old as I lost the optimal opportunity for the surgery. And also, for the open heart centers, their lack of quality control. Mortality is high in neonates and in complex congenital heart disease. And without the database, it is impossible to compare results and the definition of mortality and the morbidity risk factors. I have researched the EACTS database, and there are 18 hospitals in China registered to EACTS congenital database, but only our hospital continue to upload the data. There usually to be 3 centers. Now there are only 1 to update the data. Also, the financial problems. In China, there are no health insurance coverage for congenital heart disease. If a child is going to have a cardiac surgery, they need friends and relatives' help, and sometimes they will have to be assistance from charity funds. In our hospital, about 40 to 50 complex congenital heart diseases may give up on therapy in NICU. And also, we have large number of good patients in China. Nobody knows how exactly the number is. This number increases by about 100,000 each year. This group need regular monitoring and sometimes further surgical interventions. They may need repeated procedures and interventions. They also face specific social, psychological, and behavior problems. So China still needs support. China has the largest congenital heart disease population of any country in the world. And China is trying to catch up with the developing countries. This is the pictures I took in 2003. 11 years later, I'm here. Each time I learn a lot from here. Thanks.